Evansville's mask mandate will expire Monday. Deputy Mayor Steve Schaefer says masks and social distancing will no longer be required in city-owned facilities starting Tuesday. The CDC says fully vaccinated people no longer need to wear masks indoors or out in most situations. But some businesses are taking a wait-and-see approach, given that it essentially leaves it up to people to do the right thing. Now, Eyewitness News anchor Brad Bird joins us now on the desk as we talk about these plans for face coverings and social distancing with Evansville Mayor Lloyd Winnecke, who is joining us by phone. Mayor, thank you so much for taking the time this afternoon. So this is it. It's a big moment that many people have been waiting for. What does this mean for the people in Evansville coming next week?
Well, the biggest news, Shelley, is the fact that beginning Tuesday at the start of business, in city-owned facilities, masks and social distancing will not be required. That includes the Civic Center. Again, this begins Tuesday morning. The one exception is on Met's buses, because we receive federal funding for our mass transit system. The federal government is requiring masks be worn until at least September 13th. So for all city-owned facilities except Met's buses, no masks and no social distancing beginning Tuesday.
And Mayor, this announcement by the CDC took a lot of people by surprise. Health experts, were you surprised by this? And, you know, some businesses that we are talking to say they're going to continue asking their employees and customers to wear masks. How do you react to that, and how difficult is this going to be to just kind of sort out here in Evansville when this mask mandate ends?
Well, I would tell you that yesterday's announcement was much like a lot of things that have transpired over the last 14 months. We anticipated updated guidance from the CDC on masking and perhaps social distancing, but we didn't know for sure when new guidance would be released or what that new guidance would say. So yesterday afternoon, it came as quite a surprise to us, and we frankly were pleasantly surprised that the news was what it is. And like many things during the pandemic, we're relying on our friends and neighbors to do the right thing. And what I would ask of our residents, and we've had great, I think, overall really good success with this, is that we need to respect individuals and businesses who choose to continue to wear a mask. It's certainly their prerogative, and and the detail in the new guidance says that restrictions are lifted for those who have been fully vaccinated. Obviously, there's no way to tell if someone has been fully vaccinated except whether we take them at their word. We hope that this also is an incentive for those who have not been vaccinated to get vaccinated. So, like everything else that's transpired during this pandemic, we're going to have some challenges to navigate, but I think these will not be the most difficult challenges we've had to face during this pandemic.
Mayor, it was just a few days ago that Dr. James Porter with Deaconess was adamantly urging people to get vaccinated, saying the pandemic is not over, variants are still out there, people are still getting COVID and being hospitalized. What does rescinding the mask guidelines do for that messaging? Well, I
think, yes, the virus is still in the community, but its prevalence is relatively low, especially given where, the history it's been. But the fact of the matter is, there is pent-up desire to be maskless. And it's difficult to justify, in my opinion, keeping a mask mandate, or not a mask mandate, but a guidance asking for masking when the numbers are as low as they are. I think we can have both. I think we can live without masks while asking people to get vaccinated. I don't think there's as big a disconnect as some might think. But it's hard to justify requiring them when the numbers are what they are. And we've seen great success with the hospitals and the health department in getting people vaccinated. The outreach, I think, has been really good. Clearly, there are people who still have doubts about getting the vaccine. We hope that releasing the new guidelines will encourage people to get vaccinated if they've been on the fence. We hope that the new outreaches we've tried with through Feed Evansville and the mobile clinics with Mets are reducing barriers for people who maybe couldn't get to a vaccination site. We've been really pleased with the numbers, and I think they'll continue to get better.
And Mayor, this has been a very difficult equation, as you well know. And if there is an uptick in the variants, it's a possibility, or a surge in COVID cases again, it's apparent that you'll probably have to revisit these restrictions. And with that said, how do you really define what a crowd is? What's a small crowd and a large crowd? Because the CDC was apparently left that door open on how that's interpreted.
Well, I'm not going to speculate as to what may happen if there is a surge or if there's not a surge. I mean, I 10 years of doing this work, and I've tried to stay away from speculation on just about anything. But defining crowd size, as we get more, the new guidance was just released yesterday. So, as the CDC, I'm sure they will come up with even greater guidance, as will the state, as will the health department, as to what that means. But I think it's, we've got to use some common sense, and we have to rely on our friends and neighbors to do the right thing, and that is to respect those who, to respect everyone's opinion. And we want people to get vaccinated. We want more and more people to get vaccinated. That's the best way to end the pandemic, and all the medical experts tell us that. So, we're relying on people to do the right thing and to get vaccinated.
One last question here. Let me ask you, a lot of folks are breathing a sigh of relief. This is a sign to them that, it's over. What's your message to everybody out there? It is good news, but what's your message to the folks here in Evansville?
Well, I think the message is just this. This is we're clearly not at the end of the pandemic, but we're a lot closer to the end of the pandemic than we were a month ago, 2 months ago, 6 months ago. And I think we need to embrace every new phase that is a positive. And this is a positive step. This is a good phase for us to be in. And like with everything else that's happened during the pandemic, we're going to have to, we're learning new things. We're learning new things about public health, about how to respect others' opinions, about how to respect what a private business owner may still require. And, let's embrace the moment as a positive and figure out how we can build on it to make it even better, while encouraging people to get vaccinated, so we can not have to worry about this any more than we already have.
And Mayor, you mentioned the term common sense, and we've seen that being exercised in great numbers here in our community, sometimes not so. Just want to get a real quick take here, very quickly. Lawmakers overrode the governor's veto, and now local leaders like you have the power over the health department in a pandemic. Is that a good thing, and do you see that as being an important law?
I would answer that question this way, Brad. We have had an amazingly high level of collaboration between the mayor's office, the county commissioner's office, the health department, as well as our two hospitals. I can't imagine a scenario where a decision is made by a local unit of government without a great deal of input from our healthcare experts.
All right, Mayor Winnecke, thank you so much for taking the time to talk to us today. It's been a difficult year, but hopefully we're getting outside of that tunnel instead of just seeing the light at the end of the tunnel. Thank you so much for joining us today.
My pleasure. Thanks for having me.
Thank you, Mayor.